Welcome and good day, good morning, afternoon, or evening, depending on where you're located. Those joining us live and to those listening afterwards, welcome to the 13th episode of FIP's digital program on developmental goals, setting goals for the decade ahead. Today's episode is about developmental goal 19, patient safety. To those joining us live and to those listening afterwards, welcome to the 13th episode of FIP's digital program on developmental goals, setting goals for the decade ahead. And as I said, this is number 19 we're dealing with. Thank you. I'm pleased to be your moderator for this webinar, but allow me to introduce myself. My name is Ron Goose. I'm a pharmacist from Canada and received my Bachelor of Science degree in pharmacy at the University of Manitoba in Canada. I was appointed the registrar of the College of Pharmacists of Manitoba and remained in that position for 17 years until I retired in April of 2016. The mandate of the college is public protection. During my time with the college, I was able to improve pharmacy inspection and audit programs, standards of practice in both community and hospital settings, and ushered in some very innovative provincial legislation that expanded the scope of pharmacy practice, with a focus on patient quality of care and patient safety. I worked extensively in regulators, both internationally and provincially in Canada, United States, and served on a number of boards and working groups. I'm the past chair of the Canadian Patient Safety Institute and the current co-chair of the Healthcare Excellence Canada, and also an assistant professor with the University of Manitoba, and now work as a consultant. And currently, I am the chair of the FIP Regulators Forum. Next slide, please, because enough about me. And before we begin, I'd like to share some housekeeping announcements with you. The webinar is being recorded and live streamed via YouTube. Recording will be available on the FIP website afterwards, and you can get to that by going www.fip.org. We encourage you to ask questions in the question box provided. I will monitor those questions and we'll turn them over to our panels during the panel discussion time. You are most welcome to provide us feedback through email address of webinars@fip.org. And I encourage you to become a member of FIP at www.fip.org/membership_registration. That's on your screen. And it's a great organization doing great things, and it's great to be participating with that organization. So please consider your membership. Let's begin by briefly introducing you to this digital program, Setting Goals for the Decade Ahead. Setting goals for the decade ahead. Next slide, please. Setting the goals for the decade ahead is FIP's 2021 digital program on the FIP Developmental Goals. It's a comprehensive online series event which provides coverage for the 21 goals over 21 events in 2021. There's definitely a theme there. The main aim of the 21 digital events is to mobilize global pharmacy development and transformation through the developmental goals. By engaging our profession, members, and colleagues everywhere, we aim to provide description, direction, and context for each specific goal. Next slide, please. There are 21 events that are run between March and September of this year, which average about 2 events per month, and particularly September is a busy month, as you can see, which coincides with World Pharmacy Week and World Pharmacist Day, and we'll talk a little bit more about that a little bit later. You can pre-register for all the events by visiting the events.fip.org. And we encourage you to do so and look forward to having you in our upcoming episodes. A lot of activity in September, but it doesn't stop there. We have activities going right through the end of this calendar year. Next slide, please. So we have event outcomes for today, and they're on your screen in front of you. And the 4 are to describe the FIP developmental goals and explain the components of the developmental goal, and it's all three elements being workforce and education, science and practice, to showcase the FIP tools, evidence, and resources to support developmental goal 19 implementation across the three elements, identify priorities across practice, science, and workforce and education within developmental goal 19, and then finally engage our members in an activity to support monitoring and the evaluation of the goal through data evidence. Next slide, please. I would also like to take this opportunity to remind you today is World Patient Safety Day. It's celebrated by FIP, the World Health Organization, and countries throughout the world. And our timing for this webinar is absolutely perfect to have this webinar on developmental goal patient safety during World Patient Safety Day. Next slide, please. We have three excellent speakers that I will introduce these speakers to you now. And so as the rest of the presentation go, we'll able to flow from speaker to speaker. So I'm going to take a moment to introduce them to you. Our first speaker is Jihan Safwan. Dr. Safwan is a clinical associate professor and is the chairperson of the biomedical science department at the School of Pharmacy at the Lebanese International University. She is a graduate of the Lebanese American University, where she received her Doctor of Pharmacy degree. She is also a registered pharmacist and a member of the American Society of Health Systems Pharmacists. She has multiple publications in peer-reviewed journals. She has attended multiple national and international conferences where she presented many accredited lectures and scientific posters. Her role as both a professor and healthcare professional has given her a broad clinical experience to play an active role, an effective role in the community. Our second speaker is John B. Hurtig. John is the vice chair and an associate professor of pharmacy practice in the Butler University College of Pharmacy and Health Sciences Center in the United States. Dr. Hurtig has lectured and published on a variety of leadership, patient safety, and health policy topics, and is a member of the editorial advisory board for the Joint Commission Journal on Quality and Patient Safety. He holds various national and international appointments, including with the International Pharmaceutical Federation, where he is the Vice President of the Americas for the hospital pharmacy section. He is the President of the Board of Directors for the Alliance of Safe Online Pharmacies Global, ASOP Global, where he leads the efforts to reduce the patient risk of illegal and counterfeit online drug distribution worldwide. He was awarded the ASOP Global Patient Safety Champion Award in 2018. Dr. Hurtig received his Bachelor of Science in Pharmaceutical Sciences and Doctor of Pharmacy degrees from Purdue University. He completed a 2-year health system pharmacy administration residency at the Ohio State University Medical Center, where he also obtained his master's degree from the Ohio State University. And our third speaker today, if you notice there's a pattern, we have 3 J's. So we have Jihan, John, and now Justin. Justin Macey has a PharmD and JD degrees. He leads the US-based National Association of Boards of Pharmacy Digital Health Team, which both verifies legitimate pharmacy community members and conducts research on illegal actors. Justin specializes in the intersection of law, technology, and healthcare with a focus on pharmacy practice and drug regulations. Prior to joining the NABP, Justin was a specialist in Amazon's Consumer Legal Department and Associate Director of Innovation at LegitScript. So my, oh my, we've got a team for you today. And the best thing we do is get started. But first, I have a few more bits of information for you so we can move on to the next slide. Before we hear from our speakers, we want to quickly remind you of FIP Developmental Goals. The FIP Developmental Goals were launched in September 2020 as one FIP, as you'll see on the slide. One FIP goals that bring together pharmaceutical science, practice science, and workforce and education. As per the vision of FIP, FIP believes that we can have no pharmaceutical care without pharmaceutical workforce and without a strong scientific foundation to lead us into the next decade. Next slide, please. The FIP development goals are 21 in total, and they were built on the 13 workforce development goals that were launched in 2016. FIP used the same consensus-based approach to expand the goals into a set of 21, each reflecting elements of practice, science, and workforce and education. If technology is on my side, we have a short video that you can observe the 21 goals in action. Thank you very much. And I just took a quick side trip to see the chat, and I see people are logging in and welcoming each other and introducing themselves. That's great to see. And I can see we have truly international attendance, and welcome to the webinar today. So as mentioned several times, the 19 goals focus, the 19th goal focuses on patient safety, and we have different languages posted there, and you can see that this is a critical concept in any language. Next slide, please. Developmental goal 19 includes 3 elements, as I mentioned previously: workforce and education, practice, and science. With our panelists today, we will explore and discuss each of these elements, and be reminded you can place questions in the questions box, and we will have a panel question and answer session following the third speaker, and we will then get to the questions that you've put into the question box. And if you can put in there, if your question is directed to one of our speakers, then I will make certain that we do that and direct that question to that particular speaker. But I'm certain with the experts we have on the panel, they will all want to provide an opinion or a concept as well. So the stage is set. Let's go and move on to the next slide. So we start with workforce and education, and I invite our first speaker, Jihan Safwan from Lebanon, to start her presentation. Jihan, welcome, and over to you. Jihan, are you there, and can you join us?
I'm sorry, I opened the video, but I forgot to unmute myself. So
no worries, no worries.
Thank you, Ron.
Please proceed.
Good day. Thank you. Good day, everyone. Good morning, good afternoon, good evening. from wherever you are. Today, I will be discussing the workforce and education elements of the FIP Development Goal number 19, which is patient safety. The FIP DG 19, as you can see here, focuses on the workforce education strategies that are linked to patient safety mechanisms and reducing medication-related harm in practice. The mechanisms that have been put forth by the FIP for this DG, they include 2 mechanisms for the workforce and 2 mechanisms for the education element. So for the workforce, as you can see here, they focus or they emphasize on incorporating patient safety and medication-related harm reduction skills in early career training strategy and continuing professional development strategy, as well as utilizing advanced and specialist development systems and frameworks to develop the patient safety as an advanced or specialist area for the workforce, in addition to being embedded within leadership development programs. Whereas those related to education, they include ensuring academic capacity to deliver education and training to enhance patient safety mechanisms, as well as incorporating patient safety and medication-related harm reduction in competencies and skills and competency development frameworks for pharmacy. Next slide, please. So to start with, within this webinar, my objectives will be tackling pharmacy education and patient safety, pharmacy workforce and patient safety. Then I will be presenting some examples of FIP statements and initiatives, and finally concluding with the effect of the dreadful COVID-19 pandemic on workforce and education. Next slide, please. So what about pharmacy education and patient safety? So we'll start with the pharmacy education. Within the 2020 FIP Statement of Policy on Patient Safety, they highlight within their report on education and training through participation in campaigns to educate the public on patient safety and the role of the pharmacist. The second thing is implementing patient safety training programs for all staff in their practice settings and being actively involved in medication management and quality improvement activities. Furthermore, they stress on the healthcare-related research institutes and universities to include within their pharmacy curricula courses and course content that is related to ensuring patient safety and in particular the prevention of medication-related harm and facilitating interprofessional education. Also, they recommend advocating for medication safety to be part of medical and other allied healthcare curricula, as well as collaborating with key stakeholders to develop and implement medication safety training programs, being actively involved in delivering medication-related training programs for medical and other healthcare, allied health care curricula, and of course, promoting and participating in medication safety research, which is very important, and of course, disseminating the findings of those studies to local, national, international audiences. Next slide, please. So what about the workforce now? So as for the pharmacy workforce and patient safety, that same report also explores how patient safety is a really high priority for pharmacists. And within this report, it is worth mentioning that they try to differentiate between what we mean by patient safety and medication safety. And I would like to share this with you. So patient safety broadly acknowledged as a patient being free from any harm and or accidental injuries during the course of receiving healthcare. Whereas medication safety is a component of patient safety, and it refers here to preventing and managing medication-related errors and the consequent harm in a person's medicines taking use and journey. And this is why we say patient safety, because medication safety is within it. Next slide, please. Accordingly, when trying to identify the responsible party for ensuring patient safety, we find within this report that they point out to all responsible parties who are responsible for ensuring patient safety. And these include healthcare organizations and systems, people who create legislation and policy, people who implement standards and guidelines, as well as healthcare professionals, meaning pharmacists who deliver services and provide patient care. And of course, they state that in order to make healthcare systems safer, a culture of blame, we should stop doing that. We should stop blaming each other. So we should shift from a culture of blame that neither prevents nor mitigates harm, nor does it enable a positive working environment, and rather shift towards a collaborative systems approach. We need to collaborate together in order to ensure patient safety. And this is really important. Next slide, please. So as we have already mentioned, patient safety is a high priority for pharmacists, and of course, it's a high priority for the FIP. And globally, the FIP has been working closely with the WHO, the World Health Organization, in order to reduce medication errors through participating in meetings in order to launch the Medication Safety Challenge, which was launched at the second Global Ministerial Summit on Patient Safety in Bonn, Germany. And as you can see, this is Dr. Zuzana, who is the policy advisor and project manager who was who was the representative of FIP at this summit. And one really big milestone for FIP was having the FIP telling the health ministers at the Patient Safety Global Ministerial Summit in Tokyo, Japan, about the role of pharmacists that they play in patient safety in order to change the culture regarding patient safety. Next slide, please. Regarding the approach of the WHO to safety, as you can see here in this diagram, their approach, as you can see, the patient is in the middle. So they put the patient at the center to be taken care of by the health workforce, including the doctors and the pharmacists. And of course, this health workforce should be equipped by guidance, strategies, support, in order to have the expected outcomes of having an improved patient safety, reducing the risks and harms to have better health outcomes on the long run. Next slide, please. What else has the FIP done to promote patient safety? So the FIP Board of Pharmaceutical Care has stressed in its Pharmacy Vision report on workforce and education too, through quality continuing education, enacting legislation that broadens the scope of practice, through effective communication within interprofessional teams, and this is really important, and of course, promoting regulation and legislation to ensure the safety and patient care across the multidisciplinary teams. So it's not just one person, it's all of us taking care of those patients and ensuring those the patient safety. Next slide, please. Also, the FIP Board of Pharmaceutical Sciences has emphasized in their vision on how advances in pharmaceutical sciences, they improve the discovery and use of safe, effective, and quality medicines. Also, in their strategic plan and strategic objective number 4, and I quote here, they also incorporate DG19 workforce and education elements through promoting and improving the education of students, as well as supporting continuing scientific education of pharmacy practitioners and pharmaceutical scientists. Next slide, please. Just as importantly, the FIP education, the FIP Ed, and the report on global vision for education and workforce, for the workforce, they emphasize on the need for having a high quality workforce that can ensure the use of clinically effective and safe medications, as well as the need for, of course, always we have continuous development using appropriate standards. Regarding the education element, they stress on acknowledging the core responsibilities for education, training, and professional development. And one really important thing, having equitable access to education and development opportunities for everyone. Next slide, please. Also, the FIP Ed, within their landing statements, which you can access through the FIP website, they highlight on the importance of pharmacy curricula and the academic staff in promoting pharmacists as patient advocates. This is a very nice, it's patient advocates, and empowering them in assuming their role to improve safety, as well as embedding the culture of risk assessment, risk management, and patient safety within the experiential education, and this is very important. Next slide, please. And this has been also promoted within the FIP Global Competency Framework. As we mentioned within the DG19 mechanisms at the beginning, incorporating patient safety and medication-related harm reduction competencies is of utmost importance in pharmacy curricula, as evident in this competency framework, the FIP Global Competency Framework, which clearly states competencies related to counseling patients on the safe use of medications, gathering patient-related information about adverse drug reactions, packaging medicines to optimize safety, and of course, recalling the steps to bring medications into the market and ensuring the patient safety, and finally, quality assurance. And also, this is really important, through reporting systems of pharmacovigilance, which should be available in each and every country and in each and every standard. Next slide, please. Last but not least, we cannot talk about any subject, as I mentioned at the beginning, without mentioning the dreadful COVID-19 pandemic and its effect. Regarding the FIP, they have made sure to release various statements and various reports, one of which I quote here, which is by the FIP Health Advisory on the COVID-19 guidelines for pharmacists and the pharmacy workforce, where they present relevant information and guidelines on COVID-19 pandemic for the pharmacists and the pharmacy workforce in the primary care context, and the assisting pharmacists and pharmacy workforce in preventing the spread of the disease and contributing to its effective management. And the aim of this guideline has been, what they have included within this guideline is that they have tackled the pharmacist's involvement in the diagnosis, treatment, vaccination, and follow-up, as well as the safety of the pharmacist and the safety of the patients through the personal protective equipment recommendations, the social distancing, the recommendations for the public, and on how to ensure their safety and the safety of those around them. Next slide, please. And on yet another note, the COVID-19 also had its huge impact on education, where we as academicians, they have been forced to adopt the digital transformation and to switch to emergency remote teaching. We had to revisit the curricula and update the competencies in order to embrace the online era and to adapt through online CEs due to the impossibility of having in-person meetings. But what about the quality of education that we are presenting? So here I would like to talk about the accreditation agencies and what is their point of view regarding this. And I quote the ACPE accreditation agency, which says that they acknowledge the challenges, but relaxing the standards is not an option. It will never be an option, because they need to maintain academic integrity and fulfill the responsibility to the public safety by graduating pharmacists and technicians who are ready to enter practice. So that's why we have to always maintain our integrity in order to have good pharmacists who can take care of patients and ensure the patient safety. Next slide, please. I hope I wasn't too long on you. We as pharmacists, regardless of whatever job we are working in, we are essential healthcare professionals, and we are critical members of the healthcare team, of the whole healthcare team. And here I quote Professor Parisa Aslani, who is a professor in medicine's use optimization at the University of Sydney, Australia, who says it all. We are all advocates of patient safety, but we as pharmacists, we are particular advocates of medication safety. This is what we do best. Thank you so much.
Thank you, Jihan. Excellent. I found it very valuable, especially your point on the shift from the blame culture and putting the patient in the center of all our care activities. Excellent points. Thank you for raising that. And I know that theme will be heard throughout this webinar. So thank you for introducing that. And just a reminder to those viewing the programs live, please write your questions in the question box for the panel, and we can direct it to them leading into the panel discussion later on in the webinar. Now, our second speaker is John Hertig from the United States. He will speak on practice element of the developmental goal 19. And John and I have presented and collaborated together on many occasions. So John, you're on, and welcome.
Thank you, Ron, for the kind introduction. Thank you to my colleagues at FIP for the invitation to speak about the important practice element, and congratulations to both co-presenters as well, who are doing a wonderful job articulating the importance of both workforce and science as well. And to kick things off, I think it's important to review what the practice element of the FIP Development Goal 19 is focused on. And it's really looking at how mechanisms, patient safety mechanisms, are linked to reducing medication harm. Not necessarily preventing all errors, but certainly seeking to prevent harm. Also incorporating quality assurance processes, as well as legislative and regulatory efforts. If we review the mechanism specifically, we're looking at advocating for safer medication management systems and a culture of patient safety. Dr. Jihan did such a nice job articulating the importance of a solid culture that supports a workforce. Encouraging all healthcare professionals and other key stakeholders, including patients and their caregivers, managers, policymakers, as well as educators, to design services collaboratively. We know that we work better as a team, not just within the pharmacy profession, but also with our other health professional partners. Speaking of collaboration, in collaboration with these other partners, as well as organizations, consumer groups, and researchers, we want to develop, implement, and monitor indicators, which we'll hear a little bit more later in this presentation, to ensure we can measure patient and medication safety. We want to initiate and support ongoing programs that educate the public about using medication safely, as well as the role of pharmacists in this context. We'll work together to develop, implement, promote, monitor, and review medication safety policies, procedures, as well as outcomes in all different arenas, including hospitals, primary care, community, as well as residential care facilities. And then finally, ensure systems are in place that for the supply of medicines. We know that reduced supply and shortages cause particular issues with patient safety, so we want to monitor those as well. Next slide, please. To achieve these mechanisms, FIP is engaged in a variety of different practices, has published a variety of different reference documents and toolkits. FIP really has taken a lead internationally with collaborations with agencies like the WHO to promote patient safety. Dr. Jihan did a really nice job reviewing some of the priorities set forth in this document, which is the pharmacist's role in medication without harm reference document that was released recently. This reference document provides information about what pharmacists can do to promote patient safety at an individual patient level, as well as an organizational and in policy development levels. This can be local, organizational, or through national or even international organizations. Critically important, this document encourages all of us around the world, to take new steps and make initiatives towards safer care in our workplaces. We are all advocates of patient safety, and as pharmacists, we are particular advocates in medication safety. Dr. Jihan had that quote at the end of her presentation, which I absolutely love, and it's worth reinforcing here. In addition to providing guidance and resources, this patient safety reference document provides jurisdiction, country level information on what are the initiatives going on around the world and how can we learn from each other to ensure that we're making care safer for everybody globally. Next slide, please. In addition to that document, I do want to review another toolkit that was recently released by FIP. One includes the Medicine Use Review Toolkit. This newly released FIP document provides a framework for medicines use review, or MUR, services with the ultimate aim of optimizing medication use and medication safety. This is a toolkit for implementing MUR services and conducting optimal MURs. It's ready to be directly used, or it can be adapted based on your local practices, and is also intended to be used in the management and policy development context. The contents of the toolkit include an MUR practice around the world, as well as reviewing the clinical and economic impacts of MURs. Importantly, it also lists challenges for our low-income settings, which I know particularly struggle with implementing broad initiatives. This is one great example of how FIP is providing tools for practicing pharmacists. But in addition to FIP's fantastic work in this area, there are other organizations I want to highlight, next slide please, that are doing wonderful work in the field of medication and patient safety. One of those groups is the International Medication Safety Network, or IMSN, who has work and initiatives going on in the region of the Americas, which I represent for the hospital pharmacy section, but also in other places around the world. The International Medication Safety Network is made up of safe medication practice centers, regulators, as well as pharmacovigilance centers from around the world. And it was established to improve patient safety by operating medication error reporting programs, as well as producing guidance. I present this to you because it's a good example of global collaboration, and it complements the FIP initiatives that we've already discussed. Rather than releasing a toolkit or an important reference document, what I want to review is some specific initiatives that can directly and positively impact patient care globally. And if you go to the next slide, I'll review 3 of these initiatives. These initiatives are based in practices known to cause fatal and harmful medication errors despite repeated global warnings. These three initiatives I'm going to review today are intended to help focus some of our efforts. So we have broad impact documents, we have reference documents and toolkits, and also localized efforts that can save a life today. And these three are: one, the removal of concentrated potassium chloride vials from nursing units; two, use of weekly dosage regimen defaults for oral methotrexate, specifically for non-oncologic use; and three, dispensing vincristine as well as other vinca alkaloids in a mini bag of a compatible solution rather than in a syringe. And what I want to do is I want to walk through these briefly in the next few slides. One, this is remove ampules of vials of potassium concentrate injection from inpatient units. As many of us know, potassium is an electrolyte replenisher, which is frequently used to treat hypokalemia as well as other electrolyte abnormalities. Worldwide, intravenous potassium chloride, acetate, or phosphate are available in vials and ampules of concentrated solution. Unfortunately and tragically, errors have occurred following rapid direct infusion of concentrated potassium solutions. Vials of potassium have been accidentally used instead of, say, sterile water or saline, usually with incredibly harmful or fatal outcomes. Therefore, it's recommended that we eliminate potassium concentrated injection from nursing units or wards, and really the pharmacy profession can take a key role here in managing the use of this medication and promoting the use of premixed or other prepared solutions to reduce the likelihood of harm. Next slide, please. The other initiative I'd like to discuss surrounds methotrexate. Methotrexate is a folate antimetabolite used to treat many tumor-causing diseases, but also is used for non-oncologic conditions, for example, rheumatoid arthritis. Rather than its oncologic use for non-oncologic conditions, the drug is administered weekly. For cancer treatments, it's more frequently used. Unfortunately, for non-oncologic use, say rheumatoid arthritis, many have incorrectly prescribed it to a daily regimen, which can cause significant harm and death. Therefore, as a default, we should be prescribing and dispensing as well as administering oral methotrexate once weekly and specifying that specific day of the week. Enter a weekly dosage regimen for oral methotrexate as a default. And if you need it more frequently, then it requires that additional input to schedule it more frequently rather than vice versa. And that will help avoid some significant harm for patients who don't need it so frequently. Next slide, please. The final specific initiative I want to discuss involves preparing and dispensing vinca alkaloids. Vinca alkaloids, vincristine, vinblastine, vinelorbine are chemotherapy drugs that are administered intravenously and never by any other route. Unfortunately, deaths have been reported around the world when the drug is dispensed in a syringe and then given in a different modality. Specifically, intrathecal administration of vinca alkaloids has led to the destruction of central nervous systems. It's really always fatal and incredibly tragic because you typically find out right after you do it, and there's absolutely nothing you can do for that patient aside watch them suffer. So horrible situation. Therefore, I promote and we promote and the patient safety community promotes diluting vinca alkaloids in a mini bag containing a volume too large to be administered via any other route, and particularly avoiding intrathecal administration at all costs. As I wrap up with this final slide, I want to promote the idea that we together as a global community in patient safety have the opportunity to significantly reduce harm to our patients. But we cannot do that by solving the problems that we've caused by using the same type of thinking that was used when we created them. We need to be creative, we need to be thoughtful and innovative, and we need to be collaborative. And that's where the International Pharmaceutical Federation, FIP, has bound us all together in this universal goal of reducing harm worldwide. Together, through these small tests of change and these types of presentations, we can work together to meaningfully create incremental change that will save the lives of all of our patients around the world. With that, I thank you for your time. I look forward to your questions, and I'm going to turn it back over to Ron.
Thank you so much, John. Really appreciate that. Very informative, as always. And I like your point about the effective collaboration and communication being critical to patient safety. And thank you for raising the importance of this, not only in the practice sites, but also at the level of policymakers and regulators, especially around the never events, as we call them, that you've described for hospital and community practice. And just to remind our webinar live listeners that if you have a question for John or for Jihan, please put that in the question box, and the panel discussion time we have at the end, we'll go through those questions and get you some answers. And if you want to direct it to one of the speakers, please do so as well. But now it's the time to welcome our third speaker, Justin Macey, who's also from the United States. Justin and I have worked together over the past few years, and I continued to learn from him. And I'm about to learn some more as I turn the control over to Justin to cover the science element of Developmental Goal 13. Thank you. Justin?
Perfect. And thank you, Ron, and thank you, FIP, for having me. I want to start by just highlighting something John mentioned with those slides. It's always the easy things, right? Realistically, what we covered there is, change the storage, change the dosage unit, or change a toggle in electronic system to increase safety. It's always the small things that kind of take a long time to figure out, but are somewhat obvious after the fact. So what I want to flag here is really about the harmonization of drug safety science. And when we're talking about drug safety science, can I get the next slide, please? When I'm talking about drug safety science, we're really talking about things like pharmacovigilance studies, market authorization processes, which sometimes seems a little bit like it may be upstream from us as practicing pharmacists. Typically, as a pharmacist, we're relying on a prescriber, and prior to that prescriber, we're relying on a regulatory authority like the FDA, the EMA, Health Canada, Anvisa, MHRA, a collection of kind of drug regulating authorities who have approved or validated that medication is more beneficial than it is risky. And so what I want to do is cover a couple things. The first is going to be what those drug regulators are doing to harmonize drug safety science standards across jurisdictions, and talk about that briefly, because sometimes that can be a little bit prior to us seeing a patient or a medication. And then I want to talk about how organizations like FIP and NABP specifically can still help in those instances, even though it may not be totally within our wheelhouse or squarely into the location of our remit. There's still a possibility or an opportunity for us to assist. And I'll give an example of that. Lastly, I'll talk about some other patient safety aspects that I deal with in my daily life. So if you can go to the next slide, please. So when we're talking about the different harmonization examples, they're it's kind of alphabet soup of abbreviations of different organizations. I'm going to cover 4 of them here. There are more, but I want to just kind of give a high level overview. So you have the International Council for Harmonization, and their real goal is bring the regulatory authorities in the pharmaceutical industry together and to harmonize around what standards are required for drug registration or approval. So what is the acceptable standard for clinical testing? What's the anticipation of it? And trying to harmonize those so that more drugs can come more efficiently to more markets simultaneously, or without doing redundant clinical trials with minor deviations. The second here is the International Pharmaceutical Regulators Program. This is more of a forum for regulatory members to actually exchange information. How should we change the regulations? What issues are you seeing in your country? What issues are we seeing in our country? How can we adapt to that? It's an opportunity for essentially peers to share best practices from a regulatory perspective. And by the way, I've included the URL or the domain name for each of these organizations if you'd like more information about their specific efforts. I will say that each one of these organizations is has wide membership. Many, if not most, medication agencies or ministries are participating in these organizations. If I could have the next slide, please. Next is the Pharmaceutical Inspection Cooperation Scheme. This is really designed to have a centralized inspection status. So that you have a scenario where one medical agency goes and does an inspection, it could be relied on by other inspectors because the things they're looking for are the same. So this is a scenario where you're likely rising all boats, right? A rising tide rises all boats kind of thing, where we may be increasing standards as a result of that. The other aspect of it then becomes we can gain additional market efficiencies by doing so. And then this last one's interesting. So this is the APAC Regulatory Harmonization Steering Committee. The Regulatory Harmonization Steering Committee, or RHSC, is really important. It's a specific aspect of APAC that's going on. And it seems like it would be somewhat region locked because of APAC, but it's actually not. And the reality is it mostly focuses on APIs and the drug production safety standards. And since those are exported everywhere internationally, it really does impact everyone. So that's one of the steering committees that seems like there's a lot of international participation within. So with that, I'm going to move on to the next slide and talk about an example of something that an organization like FIP or NAAP can do to really assist these. Even though we're downstream potentially of a drug regulatory authority, we really can provide a great deal of benefit. So as many of you probably know, the US doesn't have a national healthcare system. Different topic, but we don't. So that means that all of our electronic medical records are fragmented. If you go to a provider and you see them, you can go down to the street to the next provider and see them, and they have no way of seeing medical records that are necessarily exchanged unless they have essentially figured that out via contract or technology interchanges. Aside from it, there's no regulated way to kind of exchange that information directly. As a result, you often have seen, especially with the opioid crisis, you've seen scenarios where you have a patient go to one prescriber, receive a prescription for an opioid, go to another go to fill it, then go to another prescriber and get another prescription and go to fill it at another pharmacy. And you'd have this scenario called what's informally called doctor shopping. As a result of this, in the mid 2000s, many states and jurisdictions in the US started developing what are called prescription drug monitoring programs. And the way these work was when a prescription is filled by a pharmacy, they submit the information for if it's a drug of abuse or a drug of misuse or an opioid in these situations, they submit that information to a centralized state level database. And that information can then be queried by healthcare practitioners like physicians or pharmacists when dispensing other drugs in the similar category. So an example would be you have patient A who goes to doctor one, they get a prescription for an opioid, they have it filled, it gets sent off to the PDMP. Patient A then goes to doctor two, gets a prescription for another opioid, it goes to get filled by a separate pharmacy. They don't see anything in their normal healthcare system or healthcare records to show that there's a problem here. But when it goes to get filled, sometimes from a technology standpoint, it'll actually collide against that PDMP, or the pharmacist or physician in either one of these cases could have checked it and realized there was an issue here. So in this scenario, you have all these PDMPs across the US, 54 of them to be precise, but none of them talk to one another. So how does the game change under the opioid crisis? Well, it means that if you live near a state boundary, you doctor shop on both sides of the state boundary then, because nobody talks to each other and the state interchanges don't talk to each other. Or if you know where the county lines are for different PDMP programs, you can do the same thing. And so what NAAP did is they created the PMP interconnect, which is essentially a very big dumb tube that allows all the PDMPs to connect information to one another, or at least 51 of the 54 across the US. This has seen massive uptake at the prescriber level. 1 out of 3 prescribers use it across the board, and it saved likely millions of lives, or at least hundreds of thousands of lives as a result of this, because you've seen a significant decrease in the overprescribing of opioids as a result. I can have the next slide, please. So changing gears a little bit, we've talked about a lot of different things that someone can do to, whether it's in practice or in the workforce or from an educational standpoint or from a regulatory standpoint, what we can do to essentially safeguard patients. But what I want to bring and talk about is the thing that I deal with most days, which is what good is all of the safety if someone's getting the drugs from the illegitimate supply chain? In my job at NAAP, we've identified more than 28,000 websites that fail to comply with NAAP patient safety and pharmacy practice standards or applicable law. And to just give you an idea of what those violations are, there's really only 3. It's a scenario where a patient is sold or purchases a prescription purchase a prescription-only drug without a prescription. It's a scenario where someone is selling prescription-only medication online illegally without the appropriate licensure, right? So you have a typical drug dealer selling drugs, or the third is someone is selling drugs that have not gone through the appropriate process for authorization in a market, where they've bypassed the legitimate supply chain. Those are the big three things that we see. If you go to those 28,000 websites, you'll either see that they're doing that themselves or they're facilitating it through another site. So that means that about 95% of websites that we've reviewed operate illegally, that sell prescription-only drugs or operate illegally. 89% of those reviewed by NAP did not require prescription for sale of prescription-only medicine. And when we do consumer surveys, or ASOP does consumer surveys on this, and we get additional information, we find that less than 5% of US consumers are aware of any tools to figure out which pharmacies are safe. And when we ask both patients and practitioners about could they identify which of these two websites is safe, they can't. It's a coin flip. You go to the next slide, please. So I want to talk about kind of how we meet the patients where they are. It's great if we have excellent safety mechanisms in our pharmacies and our hospitals, but none of that matters if the patients don't use them. So it's really important we appreciate where patients are, and where patients are going is the internet. And so NAP reviews pharmacies with online presences to ensure they're properly licensed to follow applicable law and best business practices. We have several different accreditations that are offered globally. And what we've seen is the private industries, or people who do business with pharmacies, like advertisers and the like, have really picked up on this. So NAP's verification, and that's either the digital pharmacy program or the .pharmacy verified websites program, are leveraged by a collection of companies. So Visa and MasterCard both require them for certain card not present pharmacy transactions, meaning if you are conducting a credit card transaction, but you do not physically swipe the credit card, it's a card not present. The Visa and MasterCard are really worried about illegal online pharmacies, and they can't tell the difference between someone who bought from a legitimate pharmacy but didn't swipe their card, or someone who bought from an illegal pharmacy and didn't swipe their card. So they bundle them all together, and we see that verification required there. Google, Bing, Snapchat, Twitter, TikTok, Reddit all require verification or accreditation prior to any online advertising. That's as a result of the US FDA prosecuting Google back in the late 2000s, early 2010s for the online advertising of illegal online pharmacies. The prosecution led to a settlement agreement where Google admitted wrongdoing and paid $500 million. And back then, that was still a lot of money for Google. So there are big fines and there are big plays here. And so you've seen most of the legitimate third-party kind of actors or gatekeepers really leverage these verifications that NAP offers in order to increase patient safety. And we think that's a really good effort from someone we don't necessarily think is in the patient safety game. Likewise, there are scenarios where states sometimes require NAP accreditation depending on a business model. So if it was a non-resident state shipping into the state who's licensed and a certain percentage of their business is coming from the internet, they likely will require accreditation. They've often required accreditation as well. So, and with that, I'll go to the next slide, please. If you'd like additional information about drug safety science or topics on that, there are several great recordings, two here on the topic specifically from FIP. And if I go to the next slide. And there's additional one specifically about the culture of community pharmacy practice and how to comply with regulations. With that, I will turn my time back over to Ron. Thank you.
Thanks so much, Justin. The programs that you reference really do place patient safety in the forefront, and especially with these online times where the patients are more inclined to look online for drug information and drug products. These online safety programs that you've described really provide that additional patient safety, but we still have a long way to go. And I also like how you discussed at the organization or regulatory level, there's important work to be done to increase patient safety, as there is right at the patient-centered practice site. So next slide, please. We are now going to move into the panel discussion, and I would welcome all three panelists to join me now. And I'm monitoring the question box, and we had some questions come to us in advance. So let's start with one of those. And I'll direct the question to one of our speakers, but invite others to join in to make their points as well. So first one, Jihan, I'd like to, again, thank you for your presentation. And part of your presentation was the teaching of patient safety curricula in the undergraduate program. But what often can happen is the students or the interns, or in fact the new graduates, when they get into those practice sites and they see something that, you know, seems like they would, how the practice is normally done at this practice site, but it really has some risks when it comes to patient safety. How do we empower those students? How do we empower those young practitioners to sort of stop the process, or at the very least speak up and question the process that might be placing patients at risk, and therefore by doing so, a change might very well prevent a mishap? So how do we empower those students and move this to the next level?
Thank you, Ron, for your question. So basically, when we're talking about students at the practice sites, before getting into the practice sites, we need to have the students, since the first year, since their first professional years, we need to have a core curriculum that teaches the patient safety, starting the first professional years and through their graduation, through their residency. During the first year of school, we need to have a goal of creating entry-level practitioners with a broad base and skills that can be used to improve patient safety. We need to have faculty that are fully committed to ensuring that those students become expert sources of safety information. I think one very important